Hello, my name is Laverne Partlow, and I have been asked to share with you information about my profession and my path to how I got to where I am today. I currently work as a health education coordinator at the Gaston County Department of Health and Human Services Public Health Division, but people out in the community still know us as the health department. So, as a health education coordinator, I oversee programs and initiatives that focus on healthy eating and increased physical activity. So, with the healthy eating portion, that I actually work with communities such as the planners or convenience stores to actually help provide opportunities where people are able to eat healthier. You may not have heard of the term of a food desert, but many of our communities where there's no grocery store or a farmer's market or a community garden, those are considered food deserts. And so that's what I am working with communities or cities and towns to actually address the food desert issues of having fresh produce, fruits, and vegetables for communities. The other portion of my position, which is working with active living or helping people to be more active, I actually also still work with planners to actually plan for parks and recreational facilities such as greenways, trails, sidewalks in communities so that people can have ways to be active without being members of gyms and having contracts. And so that's what overall working with the community to actually address the issues around healthy eating and physical activity. And I have been in my current role recently celebrated 15 years. So now I want to talk to you a little bit more about my path and how I've got to this point in my career. So I attended the University of North Carolina at Greensboro and received a Bachelor of Science in Health Education with a focus on community health. And then I received a Master of Education in Health Promotion from the University of North Carolina at Charlotte and still had a community health focus. And from there, my career path led me to my first position with the Iredell County Health Department, which is in Statesville. And my first in that role, I actually did clinical education as well as community-based education with the focus area of HIV, AIDS, and other communicable diseases. So I was able to go into schools, churches, also did education one-on-one in the clinic when somebody came in to be tested for HIV or for another communicable disease. And I actually did education and wellness out in the community to help people prevent or help them with the skills to prevent being infected with the communicable disease. So I did that position or I was in that role as a health education specialist for 2.5 years. Then from there, I went to the state health department with a focus on women's and children's health and more on a focus of maternal health with a focus on African American women and their families. So in that role, I was more of a consultant and not necessarily doing community-based education, but I worked with local health departments and other community-based organizations to help them to address the infant mortality issue, particularly in the African American community. So I provided trainings where people could learn more about the issues and be more aware as they were working with families directly. So that training included nurses, health educators, outreach workers, and then a second part of my job was to actually oversee a grant project. So community-based organizations who wanted to address infant mortality and maternal health issues, that they didn't necessarily have the funding to do those programs and projects. So then we implemented a grant program where people, organizations could apply for small grants to actually start working in the area. So I oversaw the residents who actually, or the people in the community who actually helped me to decide what grants needed to be funded and what grants needed additional work in order to be successful the next time. So I did that role for 5 years, and that was actually in Winston-Salem. So my areas covered Winston-Salem and Greensboro and High Point. So those 7 years provided me the skills and knowledge that I needed to be successful in the job that I currently have. So I went from communicable disease outreach and education to doing program consulting in maternal and child health. And then I actually am in my current position for 15 years with a focus on healthy eating and increased physical activity to address death and illness around chronic diseases such as high blood pressure, diabetes, and things of that nature. So I know I gave you more about me, but I wanted to tell you a little bit more about the overall profession. So as health educators, we often are asked, well, are you nurses? Well, no, we are not nurses, but we can do where nurses might do clinical education only. We are equipped to do both clinical education as well as education to large groups out in the community, which our goal is to do more education and awareness out in the community so that people can take better care of their health and be more educated and aware, so that they don't have to go to the doctor or to a clinic as often and can be able to recognize the signs and symptoms of any illness that they may have. So again, my name is Laverne Partlow, and I'm a health education coordinator with the Gaston County Department of Health and Human Services, and I am delighted that I have been asked to share with you about my career and my career path.